So there are a lot of things here coming along at ASH. I think as far as some of the highlights, we can go by some of the different lymphoma subtypes. One of the things that I thought was very interesting is some of the new data in Hodgkin lymphoma. We have some studies using immune checkpoint inhibitors, and we have what I think is one of the first combination immunotherapies for Hodgkin lymphoma, a study looking at ipilimumab along with brentuximab vedotin, which is an approved drug. So the idea of a drug like Hodgkin lymphoma that has a strong immune component, being able to target it with a combination immune therapy seems of interest, and there's some data there. We also have additional studies, a study looking at brentuximab in combination with chemotherapy in elderly patients. In particular, the audience certainly knows ABVD chemotherapy as being a standard for Hodgkin lymphoma, but that is something that for older patients is somewhat less effective, somewhat more toxic. There have been attempts to look at brentuximab as an initial therapy for Hodgkin lymphoma as a single agent. Those showed activity, but really limited durability. And so we now have kind of the first studies to essentially use upfront brentuximab with one or two chemotherapy drugs, either bendamustine or dacarbazine, showing perhaps greater efficacy. And so the idea that for older patients we can use a brentuximab-based regimen with perhaps one or two drugs of chemotherapy might be more effective than single-agent brentuximab and avoid the toxicity of ABVD.